So on this, good morning, how are you?
I'm good, thank you.
Good. As we're preparing for my hysterectomy,
You are going to have a hysterectomy.
and there'll be more to discuss about this after I have it.
Yeah.
But there was a lot of confusion because I've had a few friends that have had hysterectomies this year, and my sister as well.
Your twin sister.
My twin sister. So I couldn't let her have a hysterectomy without me having one. So I had to squeeze it in by the end of the year, right? What's interesting is everyone is in other places, right? Different areas living, not in Santa Barbara. I'm in Santa Barbara, but everyone else has not been in Santa Barbara. So seeing different physicians and physicians doing things very differently than one another. And we've all kind of been chatting about the way hysterectomy has been explained and performed on them. My sister had everything removed, cervix included, through her vagina.
So you mean the uterus, the cervix, the tubes and ovaries were all removed in her case?
Yes. I had another.
And it was done laparoscopically?
Laparoscopically with the robot.
Yes. And it was removed through the vagina?
Yes. And then I had another friend that had, evidently it was done laparoscopically with the robot. She kept her cervix and her ovaries, and everything was cut up and put in a bag, or cut up in a bag and removed through one of her small incisions.
Yes, and there's a question in her case as to which of the incisions.
And I don't think any of us
was
know the
used.
answer to that
Right.
question. I personally think it was her belly button one, because
Right.
I saw her belly button and it seemed like an 1.5 inch long scar.
Yeah.
Okay, then there's me, who I am keeping my cervix, want my ovaries, my uterus. I don't think I have fallopian tubes anymore.
No, you don't.
And so my doctor here, Dr. Maida,
Yes.
wants to use my C-section incision to, he wants to,
remove the
yeah, he
uterine
wants to
body.
do it laparoscopically with the robot,
Yeah.
but use that incision because I'm keeping my cervix. So there's just, I think that as everyone obsesses on, oh, you don't want an incision, like a big incision,
Right.
because of your recovery will be longer. I want you to touch on these things, and most importantly, recovery, because you've seen it all with patients in recovery. And the most Googled part of hysterectomy is recovery. What is the recovery?
Okay.
So if you're looking at the way everyone had it done in their recovery, and also going into why a surgeon makes the decision they do initially.
Yeah. One topic of discussion with this is whether something is done laparoscopically or in a traditional way. There are basically three ways of doing a hysterectomy. It can be a transabdominal hysterectomy or a total abdominal hysterectomy, which is making a big incision, either like a C-section scar or even a midline vertical scar, and removing the uterus, tubes, and ovaries, and maybe taking the cervix as well.
But do they do that anymore?
Not often. Sometimes you need to if the uterus is really big.
So if like cancer was a question, like a serious question, would they do it that way? Who's
Maybe.
doing that anymore?
Maybe.
Who does that anymore? Because that seems like that was a long time ago.
Yeah, it wasn't until 1989 that a laparoscopic hysterectomy was first performed.
Yeah.
And once the Da Vinci robot was cleared for gynecological use, which was in 2006, a lot of hysterectomies have been done laparoscopically, but still not most.
So people are still doing that.
They're
big
still
incision.
having big incisions, yeah.
Oh, wow. I didn't know that. I thought that stopped a long time ago.
No, I still think the laparoscopic procedure is less than either a vaginal or a transabdominal hysterectomy, but I'm not actually sure of that now because there's definitely been a move because of the use of the robot. The So there are the laparoscopic benefits by utilizing smaller incisions. But then you have the questions, how do we get this? We can detach the uterus from everything we need to detach it from, but then we still got to get it out. So are we going to take it out through the vagina, or are you going to take it out through another incision or enlarging one of the small incisions that you already have? It depends on whether you want to keep the cervix or not. And there's a lot of evidence now that leaving the cervix is beneficial. It's the keystone of the pelvic floor and strength at that point. So that's a good reason. There is a slightly safer operation because you don't get as close to the ureters with a supracervical hysterectomy, in other words, leaving the cervix. And
Wait, you don't get as close to the what?
The ureters.
Ureters.
Yeah,
Okay.
The ureters, yeah. And there is thought to be less pain and less likely to be any changes with sexual experience leaving the cervix. But
is there still a way to get it out, though, through the vagina if you keep the cervix?
Yes and no. Yes, you can. An incision can be made in an area that's called the posterior fornix, which is behind the cervix, but at the apex of the vagina. And the body of the uterus can be removed that way. That's not done very often, although there were times when we did that more frequently because of availability of other pieces of equipment. But a very common way of doing it is to either put it in a bag and intra-abdominally cut it up into smaller pieces and take it out through.
How do you get the bag in there? You just put it through one of the little incisions?
No, it actually comes in through.
Or the vagina?
No, the bag is passed through one of the incisions that you've already made to do the laparoscopic hysterectomy.
And then you just
you
snip everything and put it in the bag?
Yeah, so you don't spill any of the contents.
How are you even doing that?
That's like a little bit of laparoscopic gymnastics, frankly.
Yeah.
Or when everything is thought to be benign, not cancer, you can enlarge one of the other incisions a small amount and get it out that way. And the thinking in your case is you already got a cesarean section scar. So let's just take a small scar in that same area and get the body of the uterus out that way. And your uterus is small, and so it can very easily come out that way without enlarging this, without putting another big incision there. It's not a very big incision. It may be an inch, 2 inches maybe. So that's what makes sense in your case. Then there's no involvement of incisions in the vagina, and you've got no increased scars in the abdomen other than the laparoscopic ones, which is small. And you're getting benefits of laparoscopic procedure or minimally invasive surgery. You're not getting any increase in the numbers of scars on your abdomen. So it makes sense.
Yeah, they can even use my same laparoscopic scars too.
Yeah, and those might be used. Yeah. Although with the robot, the laparoscopic incisions are a little higher in the abdomen.
Oh, okay.
And that's why I really never used the robot to do any hysterectomies that I did. We did what we call straight stick laparoscopy, using smaller incisions than the robot uses, and they're actually lower in the abdomen, so they're more likely to be hidden by a bikini.
So where are they going to be? Below my rib cage?
They'll be definitely below your rib cage, but maybe not right down under a bikini scar.
Okay.
But that's just because the robot is used so much now.
Yeah.
It's common to do it that way. I was trained on the robot, and I didn't like it. I didn't feel I couldn't feel the tissues the same. I could do a better job with straight stick laparoscopy than I could with the robot. So It was better. I didn't need it, didn't want it.
You're not doing it.
But I'm not doing this one.
Okay, so what about recovery?
But I am referring you to
the
person who I feel is the best gynecological surgeon in Santa Barbara.
Yeah.
And that he happens to be a cancer specialist.
Yeah. What about recovery?
Recovery is the smaller the incision, the better the recovery generally. Mm. You're probably going to go home after the operation.
Yeah.
The night, actually. But sometime you're going to go home. You're not going to stay there forever. But you may go home the day of surgery or the next day. You're going to move slowly. There's going to be a moderate amount of pain. There'll be pain medication for you. And attention needs to be given to diet and keeping your bowels working well, because constipation is a real problem with any abdominal surgery and needs to be avoided because it can be really painful. But knowing you're going to be up and around in a couple of days.
Yeah.
And you'll be driving within a week.
Yeah.
And you'll probably still be making the bed and doing the cooking.
Probably.
But I will be there.
Yes.
To help.
Yes. Okay. But in terms of if you have a vaginal, everything out through your vagina and you're recovering, it's pretty much the same recovery because
Yeah. Taking everything out through the vagina is probably the fastest recovery. But it's really not much different from a laparoscopic supracervical being taken out through a relatively small incision. But we try to keep incisions to a minimum with any surgery for cosmetic reasons. But as you have a C-section scar, it makes sense to do it that way.
Yeah. But it's not, oh, he's doing that because it's easier. He's doing that because it just makes sense given what has to be done for me to do it that way.
Right.
Okay.
So
great.
And I'm sure everything will go well.
Yes, me too. Okay, thanks.